Morning, San Diego's physicians. President Sherry Franklin, MD, and I are going to give you a quick update on what's going on in the wacky world of medicine and healthcare. First, on Medi-Cal cuts. As you know, for the past 3 years, the Medical Society and CMA have been fighting in court to keep the 10% cuts that were proposed first by Governor Schwarzenegger and then by Governor Brown from happening. So for 3 years, we've in the courts have held that at bay. Unfortunately, the Ninth Circuit has refused an appeal, and as of right now, there is no further appeals possible. And so from the judicial system's perspective, the governor can enable those cuts both prospectively and retrospectively. The big concern we have right now is with the clawback. In other words, can the governor say to folks who have been seeing Medi-Cal patients, and everybody knows that Medi-Cal rates are near the worst in the nation, and so the people who are seeing Medi-Cal patients are my heroes. Can the governor go back and say, guess what, we want 10% of those really crappy rates back? Can we claw back those retrospective 10% cuts? We don't know the answer, but we are certainly hard at work preventing that from happening. In fact, today there is a huge, and I mean huge, rally in Sacramento to specifically bring to the attention from the perspective of labor, the hospitals, the doctors, the patients, why this is a really dumb idea. You never know what the impact of those rallies has, but we're certainly making the effort. We're also, through the legislative process, through the budgetary process, working to prevent the clawbacks and on a go-forward basis, prevent the governor, particularly since we at least have now gotten out of the massive budget deficit world, to prevent him from taking 10%, as I said, off of already crappy Medi-Cal rates on a go-forward basis. Next item is Tricare. If you have not already heard, please read the news you can use that accompanies this video and make sure you ask your carrier what the impact is on you of the new contract with United on veterans services. If you provide Tricare, you need to read what it says in news you can use to make sure you haven't left yourself open for a potential lawsuit. So take the action, find out what's going on with Tricare, and talk to your carrier. Item 3, scope of practice. There are 3 major scope of practice incursions. Our allied health professionals, whom we can't live without, some of their leadership are trying to take advantages to expand their scope of practice beyond their training. And what we are arguing for vociferously is that physicians should be in charge of the healthcare team. We've been pretty successful at whittling down the ask by the optometrists and by the pharmacists. We've not been that successful with the nurse practitioners. This is all in the Senate. All 3 of those bills have been thrown over the transom and are being worked out in the Assembly. So the battle right now is to fine-tune the successes we've had with the optometrists and the pharmacists and go for the big solution on the nurse practitioners. Shortly, if you have a story about why it's a bad idea to have allied health professionals practice independently, we will be asking you for those stories. So if you have some about why it does not make sense to have non-physicians be leading the healthcare team, we'll ask you for that information. There are 2 trainings coming up that I would encourage all of you to participate in. The first is media training. If to you is a verb, and for some of us it is, then that was a joke, by the way. I just put an in there. The media training occurs on the 13th of July on Saturday. We put a camera in your face and we ask you to speak to the camera, do radio interviews, do television interviews. It's very, very helpful for you to learn how to do that. And so on the 13th of July here at the Medical Society, we'll be doing that. And if to you, legal and financial skills was not something you picked up in medical school, on Saturday the 22nd of June, again, check the news you can use for the details. We've got a great course that I teach about how to deal with the legal world, how to deal with the financial world. MICRA, the fight is on. The big thing that I want everybody to recognize is that we will prevail in the legislature. We've worked for 10 years to keep any MICRA assaults from happening in the legislature. That's the good news. The bad news is if you have enough money, you put anything on the ballot. And so the focus will be both in the short term addressing the prospective MICRA legislation in the legislature, and in the medium term is preventing the folks who are attacking this, the trial lawyers, from putting something on the ballot. If it shows up on the ballot, that's going to be big, big bucks, and we will be asking everybody to pitch in to keep the trial lawyers from bypassing the legislature and going straight to the people. White Coat Gala this Saturday. President Sherry Franklin, who will be on very shortly, will be thanked for her services, and we inaugurate President-elect Bob Peters. So that will happen this Saturday. If you haven't bought your tickets, it's not too late. Finally, top docs, particularly for our solos, smalls, and medium-sized physicians. We have created a no-lose proposition to make sure that the solo, small, and medium physicians are given an equal shot at being honored by top doc selection. We're not taking anything away from the large groups, but we added through a process so that physicians who practice in solo, smalls, and mediums are compared to each other. None of that is effective if you don't vote. So if you don't vote, quite frankly, you can't complain about the outcome, because we have changed the process to make it easier for solo, smalls, and mediums to be selected by being compared to fellow smalls, solos, and mediums. But if you don't vote, it doesn't happen. Madam President, you have the floor.
Well, good morning, everyone. I wanted to review with you a couple of things. This weekend, I went to the 16th Annual California Healthcare Leadership Academy, and a lot was talked about in terms of the economics and the business of medicine and how it's going. We discussed it at length. We had economists, masters of public health experts, as well as other financial experts come in and talk to us all about where we're going to be going. As we know, the ACA has within it a number of reporting requirements. It's looking for quality assurance, outcome measures, special coding requirements, communication between patients as well as other institutions and other providers. It's supposed to be between all modes of practice. There's supposed to be a patient portal associated with the information technology, and information for everyone to communicate regarding hospital follow-ups and where the patient needs to go after that. Although we all intuitively understand that this is needed and that it's essential for the appropriate care of a patient, it's going to be a very onerous thing and a very expensive thing for people in smaller to medium-sized practices. There are a number of very large institutions that can already do all of this, except for the communicability between institutions, which I think will take a long time to get to that place. CMA is actually starting to look at ways to provide tools for these smaller practices, to provide them with the infrastructure and the IT necessary to be able to compete on a level that's appropriate and what's being asked by the ACA. And in the process, we might be able to continue the amount of competition, allowing us to truly improve healthcare. The main concern at higher levels is, as we see these larger behemoth medical groups or institutions start to form in the form of ACOs, they will have incredible negotiating power. On the one hand, that's good. Physicians will be paid more. But on the other hand, that might be a problem. If you're protected against antitrust laws, which the ACOs are, then they can negotiate in a way with the health plans that we've never seen before. And potentially that could raise rates for everyone. As part of the ACA, you can't go above a certain amount of family income. I believe it's 9%, before you're afforded a subsidy. So as those rates go up, even if a family, a middle-class family, can't afford that, they will then be provided subsidies. But those subsidies have to come from tax dollars, which means we're constantly raising taxes to meet those needs. Again, I don't know whether that's good or bad, but we are concerned about the rate of rise of cost of healthcare. And the only way to diminish that would be to continue to allow some sort of competition. And your CMA is working to do that, to provide us the necessary tools to equal the playing field just a bit. I wanted to bring this to your attention because I know that a lot of people are becoming very discouraged. They're becoming discouraged that as healthcare moves forward, that nobody's thinking about the smaller business. And I just want to let you know that we are. We're going to try and do something about it. And if you just stay tuned.